Welcome to today's Explainer. We're tackling a topic that is, well, incredibly sensitive, but honestly, it's so common. Today, we're walking through a patient guide to erectile dysfunction and male fertility, based on medical insights from ART Fertility Clinics. We're creating a totally warm, judgment-free zone right here today, so let's just dive right into it. Before we even get into the science of it all, I want you to consider this. It causes significant depression and anxiety in men and their partners and impairs quality of life. I'm reading that because if you've been feeling overwhelmed or stressed or just feeling like this is taking a massive emotional toll on you, your feelings are 100% valid. Medical professionals completely recognize that this isn't just physical. It is deeply emotional. You are absolutely not alone in feeling this way.
Okay, here's our roadmap for this explainer. We'll start with 1. Understanding ED. 2. The root causes. 3. ED in your fertility. 4. Diagnosis and testing. And finally, 5. Prevention and treatment.
Let's start with Section 1, Understanding Erectile Dysfunction, defining the condition.
So what is it exactly? Erectile dysfunction, or ED, is just the loss of ability to get and maintain a firm erection for intercourse. That's it. Stripping away all the complicated medical jargon, it's really just a functional issue in the body. Demystifying the terminology like this is the very first step to taking your power back.
So what are the vital signs we're actually looking for? The main symptoms include an inability to achieve an erection, an inability to maintain one, or experiencing a reduced sexual desire. But I really want to emphasize something here. We are looking for a specific, recognizable pattern over time. An isolated incident happens to almost everyone. ED is really when these symptoms become a consistent, recurring pattern.
Moving on to Section 2, the root causes. Why is this happening?
The causes generally fall into two distinct camps. On one side, we've got physical problems. This is stuff like inadequate blood flow, nerve signal issues, chronic conditions like diabetes or hypertension, and low testosterone. On the flip side, we have emotional causes. Those are things like depression, anxiety, chronic stress, or relationship conflicts. It's a complex interplay between the mind and the body. And listen, it is not a character flaw. It's a health condition with identifiable, completely traceable roots.
Which brings us to Section 3, ED and your fertility. The big question.
Does erectile dysfunction mean I cannot have kids? Wow, it's a terrifying question, right? If this has been keeping you awake at night wondering what your future holds, I promise you your reaction is completely normal.
But here is the reality. You can still produce healthy sperms. This is huge. The core issue with ED is simply transferring the sperm to the partner, which, yes, absolutely makes natural conception complicated. But the sperm itself, it can still be perfectly healthy. ED is essentially an intimacy and delivery hurdle. It is not automatically a sperm production problem. So your fertility potential is very likely still fully intact.
Okay, Section 4, Diagnosis and Testing. What to expect.
So what does a doctor's visit actually look like? Step 1 is a physician discussion and questionnaire. Step 2 is a physical assessment. And Step 3 involves lab tests and an ultrasound. Let's demystify this right now. That first discussion? Sure, it touches on your privacy. It might feel a bit vulnerable, but the doctor isn't there to judge you. They're acting like a medical detective. And your honest answers are literally the best clues to finding the real reason behind the problem.
As for the testing, what are they actually looking for? Well, blood and urine tests check for underlying conditions like diabetes, heart issues, or they check your testosterone levels. They might do a psychological exam just to screen for things like depression. And an ultrasound? That's literally just a painless video image to check the blood flow in the area. Simply put, these are just standard tools to check your overall health. Think of it as routine maintenance.
Finally, Section 5, Prevention and Treatment Options. Taking back control. Your lifestyle matters immensely. Remember those physical causes we talked about earlier? You can combat a lot of them through weight loss, minimizing alcohol, quitting smoking, getting regular exercise, and managing chronic conditions like diabetes. Proper counseling for anxiety or stress is just as vital. These aren't just generic health tips, folks. These are direct, proven ways to improve your blood flow and nerve health. You're putting the control directly back into your own hands simply by tweaking your daily routine.
And hey, if lifestyle changes aren't quite enough, modern medicine completely has your back with a wide variety of interventions. We're talking oral medications, penile injections, vacuum devices, testosterone therapy, and even surgery like a penile implant. Doctors don't just guess here. They tailor the exact treatment specifically to the root cause and the severity of your unique situation. There are so many incredible tools in the medical toolkit to help you overcome this.
So, are you ready to take the first step toward regaining control of your health and fertility? ED is incredibly common, it is entirely understandable, and most importantly, it is highly treatable. You don't have to navigate this in the dark. Booking that initial consultation is really the very first step forward. Thank you so much for joining me for this explainer. Now take this knowledge and go take charge of your health.